Hello, and welcome to Challenging Your Health Mindset. This podcast is produced and presented by Liberty University's Student Health Center and Wellness Initiatives Department. Hey, welcome back. This is Season 5, Episode 2, and we have for our discussion today in the dimension of physical wellness, our special guest, Dr. Vicki Moore. She's here with us, and we're going to be talking about Cervical Cancer Awareness Month. And so we're so glad to have you here today.
Thank you. I'm honored to be here with you.
Awesome. And I have a co-host this morning. And Caitlin, won't you give us an introduction of yourself? Tell us something about you.
Yeah, so my name's Caitlin Hutton, and I am an assistant director at the Health and Wellness Department. I've been here for a little while, and I love to learn more about physical wellness on all 9 dimensions.
Cool. And so, Dr. Moore, why don't you take a few moments and tell our listening audience about yourself?
Well, I've been a nurse for over 40 years. I started as a nurse in the operating room at Virginia Baptist, which is part of Central Health. Then I became a family nurse practitioner, and I've always worked in women's health as a family nurse practitioner, and I did that for over 20 years.
Wow.
I've been an adjunct faculty here at Liberty for over 10 years, and then I came on full-time in the nurse practitioner program about 6 years ago.
That's amazing.
Yeah, I teach women's health there, and also like acute care and some other courses. So.
Here at the university?
Yes.
Awesome. What do you like most about your career path? I know that's deviating from the topic, but you're such a beaming personality. I would love for our listeners to get to know you more. But tell me something that you love about your career path.
Well, I always wanted to be a nurse, so that was just naturally my choice. I loved working in the operating room, and I really only went to nurse practitioner school because of one of my friends who encouraged me to go with her.
Okay.
And I always thought I would
Peer
work
pressure,
in
right?
I always thought I would work in family practice, but I had an opportunity to work in women's health, and I fell in love with it when I first started. I had some opportunities to leave, but I just could not leave my patients. I loved them. I loved what I did, and I felt like I was really contributing to their overall health.
That's amazing.
Because of what I did in women's health. So
that's awesome. So women's health is so important, and it's important to me as a man because my mom's a woman,
right,
and my wife and the mother of children is a woman, and so I have a vested interest in the wealth and health of ladies, and so I'm glad to have the two of you here today to talk about it. So let's just dive right in. Cervical cancer, what is that?
So cervical cancer are abnormal changes in the lining of the cervical cells. So if you think about the anatomy, the cervix lies between the vagina, which is the birth canal, and the uterus, which houses the fetus while a woman is pregnant. And so those cells can change over time. Right. And I think the importance of realizing that is that sometimes women neglect gynecologic care throughout their lifetime. So, and I think a lot of people don't realize that cervical cancer is caused by the human papillomavirus, or HPV. So, there are different degrees of abnormalities of the cervix.
Okay.
And you can have precancer, which is easily treated, and that's one of the reasons to have early screening.
Wow.
And then by the time it develops into cervical cancer, most of those women have not had screening for a number of years, unfortunately.
So it's the neglect of early detection
Right,
Yeah.
right. Because if it's detected early, it can be treated before it turns into something. And just a little bit about HPV.
Okay.
There's over 100 types of the human papillomavirus.
Over 100.
Right, yeah. And there's certain ones that are high risk that cause cervical cancer. And a lot of women are exposed to HPV and can have cervical changes or precancer. But because our body is so remarkable, a lot
Mm,
of times the body will take care of that and get rid of it just like any other
like a
virus,
shedding.
right,
Hmm.
that a person might have. Unfortunately, again, if it's not detected and over a number of years, it
Mm,
can grow out of control
gotcha.
and turn into cervical cancer.
Wow. Are there any signs?
Well, in the early stages, no.
Okay.
Usually for early cervical cancer, there really aren't a lot of symptoms. As
Okay.
time goes on, irregular bleeding is the number one symptom. Um,
Mm,
Women tend to have bleeding in between their periods.
mm-hmm.
Sometimes their periods can be longer, sometimes they can be heavier,
Mm,
sometimes they can have bleeding after intercourse.
okay.
And sometimes they can have either pain with intercourse or just lower pelvic pain
Sure.
that can clue them in.
Wow.
Right. Well, we learned a lot about cervical cancer and heard a lot from you, but with our audience being LU, the student body, and women specifically, I really wanted to touch on the importance of cervical cancer awareness. Since January is Cervical Cancer Awareness Month, I want to touch on that, but also could you touch on understanding your family history within that?
So, yeah, it's great that we have a month that sort of lets us be more aware of cervical cancer. And I think it's good to do that to encourage women to think about their bodies and
Mm-hmm.
think about gynecologic care and just their overall health.
Yeah.
I think that this awareness helps people realize that there are screening tests out there
Mm-hmm.
and they should get these screening tests before they actually start having symptoms. That's really the importance of it. And as I mentioned before, oftentimes women will neglect this part of their care. So it's really important to point this out during that time. And just a little historical background, the mid 1940s, there was a cervical cancer was the number one cancer of
Right.
women in this country
Wow.
and around the world.
I didn't know that.
But with the development of the pap smear screening test in the
Mm-hmm.
mid 1940s and women started being screened, the risk of cervical cancer has gone down immensely, and the number of deaths, which prior to the mid 1940s was about 40,000 U.S. citizens a year,
Oh my
Wow.
has
goodness.
gone down to about 4,000 a year,
Wow.
which is really
That's
significant.
Right.
huge.
There's about 14 thousand cases of cervical cancer still diagnosed every year, but hopefully with good treatment,
Mm-hmm.
those won't turn into deaths.
Yeah, and the awareness helps out on the.
Right,
So,
right.
is there a family connection or?
In some people, there can be.
Mhm.
If a mother or a sister has had cervical cancer, then there could be a small link to a family history.
Mhm.
In some of the research they've done, they've said that there may be a genetic component in rare women
Mhm.
where they just don't clear that HPV virus like other women might clear it.
Wow.
What about age? Is there age where it impacts women more than others?
Well, usually over 30
Okay.
is where we start seeing cervical cancer.
All right.
Um, so that's the importance of getting screened early on.
Mm-hmm.
So,
Right. So you mentioned getting screened early on, and we talked about the age, but could you share about the importance of regular checkups, so vaccine schedules, screening schedules, and the risk factors of HPV?
Okay, so first of all, it is really important again to get screened.
Hmm.
Also, to consider having the HPV vaccine against HPV and cervical cancer. So, what we normally recommend is to start cervical cancer screening or pap smears at age 21.
Okay.
They found in the research that even if women are sexually active under 21, they don't normally have, the really bad changes
Hmm.
that lead to cervical cancer.
Right.
So 21 is the age that you first start. So between 21 and 29, they recommend a pap smear at least every 3 years, as long as that first one comes back normal.
Hmm.
And then between 30 and 65, there's several different options that women can take. They can have a pap smear every 3 years. If it comes back normal,
Hmm.
they can have HPV testing alone, and if that comes back normal, then they don't need another screen for 5 years. You can also, which a lot of providers recommend, have what's called co-testing,
Mm.
where they'll do a pap smear plus HPV testing to see if the patient has that high risk HPV. And if they don't, then every 5 years is the normal screening. So, again, about the vaccines really are recommended at early ages, between ages 11 and 12.
Wow.
Wow.
And if a patient gets it early, they only need 2 doses of the vaccine.
Okay.
And if after 15 years of age, between 26 years of age, they would need 3 doses of the vaccine. They can get it as early as 9 years of age, depending on what their provider thinks.
Hmm.
But it has, in the time that it's been out since 2006, has shown to have a dramatic decrease in the risk of HPV.
Yeah.
So now the HPV vaccine will not get rid of existing HPV.
It's a prevention.
It is a
Right.
preventive mechanism, but in all the studies they've done, it is well worth, taking that vaccine if you don't have risk factors against the vaccine.
Wow.
Right.
So our student body who have not uh, reached the 21 age where they start doing the screenings can still take advantage of getting the HPV vaccines.
Oh, yeah, they certainly can, up to age 26. Now, there are some high risk populations that they will give it to after age 26, but
Mhm.
normally that's the cutoff
Yeah.
for normal patients. So, but yeah, if anybody is interested, that's certainly something to consider if they haven't
Yeah.
taken
Right.
the HPV vaccine.
Well, given us a lot of information and resources, but for our student body here, I wanted to touch on a really big resource, a really great resource we have on campus, which is the Student Health Center. If you have any more questions about cervical cancer, cervical cancer awareness, they would be a great resource to reach out to.
Yeah.
Yeah.
We have full family practice care at our health center. So I'm sure, like yourself, there are several nurse practitioners and medical doctors and people there that'll help them out. And the shepherd's office is a good
Right.
place for young ladies who want to sit and talk with somebody. I'm sure they'll be instrumental in guiding them to uh, places where they can get more information. And I think that's what the awareness is all about, is to get good education
Definitely,
out
yes.
there and available and make a lifestyle change. Healthy habits create a
Right,
lifestyle,
right.
right? So if there were maybe three things that you wanted our students to hear, and not just our students, because we have a lot of faculty and staff members who are our listeners as well. If there are three things you wanted them to leave our time together today with, what would they be?
Okay, before I do that, can I just touch on the
Please.
risk factors for cervical cancer?
Would love to.
Um, just because I kind of missed that when we
Yeah,
were
yeah.
talking.
No
But
problem.
so the biggest risk factor is HPV because HPV causes about 90% of the cervical cancers.
Hmm.
So to
Wow.
minimize the exposure to risk factors, you would hope that someone wouldn't become sexually active before the age of 18.
Right.
You would want to minimize your sexual partners over a lifetime. And you would also want to consider your sexual partner if they have a history of HPV or if they've had multiple partners, because that's where the risk of HPV
Hmm.
comes in. The other thing that contributes, which a lot of people don't realize, is smoking. I mean, we talk a lot
Yeah.
about
Ah,
smoking cessation,
and the lungs.
but this is
Yeah.
one of the things that actually can contribute to cervical cancer is smoking. So we'd like to ask everyone to minimize
Yeah.
the
Right. Yeah.
smoking. So those are just two of the things that are prominent risk factors. So
Hmm.
as far as three takeaways, I think the biggest thing is the awareness,
Hmm.
and for women to consider a lifelong habit of screening for gynecologic issues.
Hmm.
Value your body.
Mm,
Right.
God gave us this great body, and we should take as good a care of it as we possibly can
that's true.
to minimize any kind of health risk. And I think, again, the second point would probably be cervical screening. Go by the guidelines that are out there for cervical screening and also consider the HPV vaccine.
Mm.
They've found that HPV also causes some of the cancers that involve head and neck and mucous membranes.
Hmm.
So, even men and boys can receive the HPV vaccine now. It's not just for women.
Mm.
So you'd want to minimize your risk by taking that HPV vaccine. The third is just to feel comfortable knowing that if you have a women's health issue, providers have been trained to talk to you and to minimize your anxiety about any
Hmm.
kind of women's health exam. Please don't hesitate to reach out to the health center here at Liberty,
Hmm.
to the shepherd's office if you need someone to talk to, like Dr. Anderson mentioned. But these providers are more than happy to see you and
Hmm.
talk with you. And if you feel more comfortable seeing a woman, you can always ask for a woman provider.
Sure.
Um, and if you feel uncomfortable seeing someone on campus, there are great GYN providers in the community that would also be happy to see you.
Absolutely.
Um, so, those would be my three takeaways from
Yeah.
this.
Listen, I feel so much more aware and informed. And as always, I enjoy being around people who are experts in their field. I did have a question that maybe someone in our listening audience who just may not know. Practitioner. What's a nurse practitioner, and what's the difference seeing that type of provider than maybe someone else?
Well, a nurse practitioner is just a nurse that's had advanced training.
Hmm.
But I think the nice thing about nursing is we come from a holistic perspective. So we
Hmm.
really are there to treat the whole patient. So
Sure.
even in my women's health practice, I had patients who would come and ask all kind of questions about their health.
Hmm.
What is a skin problem? What can I do about my cholesterol? So I think in general, nurse practitioners are just very well rounded. We work really well with physicians
Yeah.
to help guide and direct our practice in some cases. We also work with physicians' assistants,
Hmm.
but it's just another level of care for a lot of people.
Yeah. Well, Listen, I know you care, and I thank you for demonstrating that care by spending some time with Kaylin and I today. And for our listeners, I know they appreciated it. And we'd have to do something together again soon. And thank you for coming.
Well, thank you. I appreciate being here.
Thank you,
Yeah,
Kaylin.
thank you.
Thank
Thanks,
you.
guys.